Hi everyone, good afternoon. Thank you for joining us today on a very nice Sunday. Hope you have been enjoying the sessions that we've been going on before this. Today I'm actually very happy to present a very special panel. A lot of these faces have actually been at the forefront of challenging the healthcare industry, especially in the digital space over the last 5-6, right? And now we have heard it time and time again, the pandemic has accelerated adoption of digital healthcare. And that does not affect just the users and the clinicians, but today we're going to talk about the transformation that happens in hospitals and also the insurers. So, ladies and gentlemen, if you have had your lunch, go ahead and grab a cup of coffee. Join us for a very exciting session with our panelists today. I'd like to introduce Mr. Hanizar, Phang, Dr. Jin, Ezuan, Dr. Raymond. Okay. Now, there's so many things that these guys have done, but I don't think I would do any justice by just listing out their profiles. I'm going to pass the mic to the panelists themselves, okay? And let's start off with Hanizar. Hanizar, can you please tell us a bit about yourself and what you do?
Yes, okay. Hi, everyone. Yeah, basically, I'm from HealthTics. So HealthTics is more like a healthcare information system developed by HealthTics Neighborhood. So the system is more to reduce the manual tasks in the hospitals, teaching hospital, clinics, and even clinics. So we do a lot of customized solutions for healthcare industry, and our clients are public hospitals or even private clinics. So these are the things that we are doing in HealthTics right now.
Thank you, Hanizar.
Yeah.
And Phang, can we have your introduction, please?
Yeah, certainly. Good afternoon, everyone. My name is Ezuan. I'm the CTO here from HealthMetrics. And so in HealthMetrics, what we do is actually we provide a platform to connect corporate customers, which is like companies who provide healthcare benefits for their employees, right? So what we essentially do is that we provide a platform for them and to connect them to the healthcare service provider directly. So the platform itself is the aim of the platform itself is like to digitize obviously a very manual process, right? Where you sort of have to do a lot of like form filling and submission via documents, email and stuff like that. So this platform that we have provided so far aims to actually digit the entire back-to-back the user experience for a company in this case. So I think we come from a very payer side of the equation. So yeah, that's in a nutshell. So I'm the CTO of HealthMetrics, and I take care of the technology, the engineering, and the product side of the product. Yeah.
Thank you, Edmund. And next we have Dr. Jin.
Hi, good evening, everyone. So, Jin here. I'm a medical doctor by training and come from a background of clinical management and also hospital management and clinical research. So, I'm with DoctorOnCall in the area of innovation. So, essentially, DoctorOnCall is a healthcare protection platform, right? We strive to connect the general public, retail customers to the healthcare needs in every way, in the most efficient way possible. So in addition to that, we also provide telemedicine. And I guess more than just connecting them, we are striving to improve the healthcare delivery process. Yep. Thank you.
Thank you, Jin. Next, can we have Ezuan?
Hi, everyone. Good afternoon and assalamualaikum. I'm Ezuan. I'm the CEO of Medkad. So Medkad now, we are positioning ourselves as all-in-one healthcare providers, provide platform from the payer to supplier and now as provider as well. So our aim, basically, we want to bring fairness. We want to give a fairer price, a fairer quality of service, and also which will benefit to all stakeholders in this ecosystem. And yeah, we started as a payer. We are registered TPA with Mohd, and now which we will focus more on untapped market customer segment before. And now, based on the demand and from the market, so we have grown and we keep innovating, giving values to our client. Thank you.
That's excellent. So it's all about fairness, quality, and best interest for all holders. Now, last but not least, we have Dr. Raymond.
Hi, good afternoon, everyone. Thanks, Prathaban. And this is Raymond. I'm the co-founder and CEO of DoctorOnCall. Basically, in short, we are the telemedicine provider based in Malaysia, providing the whole range of e-prescribing and e-dispensing solution at the primary care network, and being the largest e-prescription provider with average of one prescription being generated every 1 minute. And we are actually targeting the primary care sector and digitalizing and transforming the whole pharmacy and the doctor's relationship, creating a good bridge between the two professionals, and how can we actually bring a hybrid care model to the patient. We talk about online to offline, offline to online. So in a nutshell, we are the telemedicine provider, like what Jean mentioned, but we actually differentiate ourselves more on the prescription side, and working with the other stakeholders like policymakers, insurance, TPAs and whatnot. Yep, that's all from us. Thank you.
Excellent. Thank you everyone for that introductions. Okay, I would just like to let the audience know if you have any questions, do type them in the chat box below. There's a function over there where you can actually post up your questions. We're going to go through a round of questions and probably leave the last 15 minute Q&A. Yeah. So I hope you guys have enough to tell our audience today about digital transformation in hospitals and insurers. Yeah. So let me start off by maybe setting the stage. Yeah. All of us have had some experiences working in hospitals and the healthcare system, at least over the last 10, 15 years. And I think from the very beginning, we realized there are a lot of things that can be better. And, hence all of our passions to use technology, modern workflows, and, do a huge amount of change management, okay, in these institutions, right? So the first questions I would have for you all is actually, in the coming digital age, are hospitals actually losing their edge? Are they becoming obsolete? Or how will that happen, if it does? Maybe I can direct that question first to Dr. Raymond. You've had experience in 2 countries, observing healthcare systems in Singapore and as well as in Malaysia. So maybe you could share your experiences and what are we to be expecting with this whole digital healthcare transformation coming ahead.
Yeah, thanks, Prathaban. I think it's a big question, right? And so based on my experience, I used to work in the UK, Singapore, and now in Malaysia. But Malaysia, I've never been working in the healthcare system, but I'm part of the healthcare system anyway, right? So if you say hospital can be obsolete, I don't think it will be obsolete at any time, right? It's a matter of the capacity needed for tertiary care, we call it, right, at the hospital. So it really boils down to how effective and efficient our primary care is, right? And if our primary care and the public health together are very effective and efficient in such a way that providing what we call the value-based care services to the patients, and then you will look at all the non-communicable disease patients, the chronic patients, right? Then if they're all very well managed because of all these primary care system, right, effectively through utilization and the offline services, right, then there will be less patient needing to go to tertiary care, right? So we're talking about the complications of all these, chronic diseases. So when we have a reduction of all these complications, there goes the capacity of the hospital will be very much, right size. And most importantly, at those cases that needing tertiary care, for instance, surgery and whatnot, will be prioritized. Otherwise, people will be jammed up at the tertiary care. So if I may summarize, right, in the near future, we will be seeing a very subspecialized hospitals or tertiary care, providing, very specialized services to the patients of, different medical needs. While primary care should actually strengthen itself. If you look at the NHS in the UK or even Singapore coordinated, primary care network in Singapore, right? So this is what they are doing with the coordination with the value-based care services, targeting at the primary care level. So at DoctorOnCall, we are actually a true believer, in the primary care. If we actually are tackling the primary care right, and efficiently, I think more things can be done, and a patient will be, needing less to go to hospitals, and even insurance premium will come down at some point, right? And just my 2 cents. I'll leave it to the rest of the speakers. Thank you.
So, Edmund, HealthMetrics deals a lot with providing value for at the primary care level.
Yeah.
Right. So maybe you could share some of your organization's achievements, or some things that you have done to actually, especially in the last 1-2 years, right, when acceptance for digital healthcare has been more open. So maybe you could share some of those great things that you guys have done.
Definitely. I think the journey of Health Metrics has always been outpatient and not so much on the inpatient. In fact, we have only recently launched the inpatient service last year. That's where we actually tackle like hospitalizations and like the tertiary care part. So up to this point, right, I think one of the biggest accomplishment that we have really done, right, is that we successfully validated the idea of how much impact the digitization can really bring, like in terms of efficiency, in terms of delivery itself. So when we first started off, right, and we were trying to get people to convert to actually start to use digital processors, like get them to actually submit claims online, and also like especially when we first started off, we were testing this idea of like getting the primary care to really like administer treatment and also perform a submission within 24 hours of the care itself. It was kind of unheard of back then because usually they get a few working days, to submit it. And so what we have done is that we say we strive and we try to get people to be on board with this, right? And what we have seen is that people are actually okay and also like pretty receptive when it comes to like adopting like practices like this. And one thing that we truly believe we have done right is that make the process pretty simple and seamless for them. Like submission does not have to be a pain, which it was a pain. That's why people are like they struggle whenever they want to do a submission, right? And in that case, when this thing is increased, submission is no longer a pain. When actually getting back the money from the insurer or the payer side is no longer a pain, right? Then that's where they can truly focus on the primary care, and having out the capacity and also delivery on that side. Yeah. So we see this in all of the metrics that we measure. Yeah.
Right. Okay. And next, I would actually like to ask Encik Ezuan. Yeah. So you mentioned earlier that it's all about providing quality and affordable, fair and equitable healthcare. Yeah. Right. So how has actually how's your company actually managed to do all of this change management, right? Because it's difficult, cheap, fast, and also good quality. But since the Uberization of our economies and the way we buy things, we want everything now at the cheapest price and at the best quality, right? So how have you been actually engaging with your clients and your partners to do this?
Well, first and foremost, that's the tagline for Medkad. We always keep mentioning that we provide a fairer, faster, and healthier together. That is our motto in the company. So fairer means what the price, the cost containment that we have. We embedded in the system, how we give value added to the clients. So that kind of value-added services that we give to our user. So the challenge, for Medkad, right? So we have been in the market since 2017, and we start we from payer stage to supplier, and now as provider within these 4 years lah. And so as a payer, Medkad, we analyze. We do a lot of analytics on the data on how we can help the market, the user, give more value added, which later on then come up with our motto: fairer, faster, and healthier. So then later on we introduced Medkad, part of Medkad, which Medkad function more to do supplying wholesale to the clinics directly, and then also we introduced e-pharmacy kind of service we call long-term medication service to our clients lah. So those actually from what we get the data from, from those chronic disease kind of, so they can subscribe our service, they can enjoy more better price, which the medicine send directly to their home. And then later on, we just recently launched Care, something similar like Amazon Care, but we call it Medkad. It's kind of telemedicine, but it's more like e-prescription kind of service. Because we do receive a lot of requests to when we do LTM service, right, long-term medication, they need a prescription. So we connect them with the doctors, our own doctors. We have our own doctors. Mm-hmm. So we teleconsultation just to make the doctor comfortable, and if not, they can always refer to physical doctor. And this Medcare actually, it's more like a virtual clinic kind of service. It's not really the teleconsultation kind of service. So this is where we try to connect. We will try to complete the whole ecosystem into one. This is what we call as all-in-one service lah.
Right, fantastic. It sounds very interesting. Next question I actually have for Hanizar. Yeah? So, reducing manual tasks in a hospital or any clinical setting is a big challenge. You know, I think our healthcare workers have a very specific way they like to work. Some of them have been doing it for many years. So, what are some of the innovative technologies or change management solutions that you have implemented? As you mentioned earlier, you guys are also in hospitals, public hospitals, and also in some clinics, right? So yeah, can you maybe tell us some of the interesting technologies that you guys have applied?
Actually, from our side, we don't implement any new technologies at the moment. It's just more on focusing on the change management, guiding our clients on the change management part, amend the policy, simplify the process, rather than adding some new features that you don't really necessarily need it. And you should be focusing more on the quality of your output of the data for your patients and also for practitioners. So these are the areas that we focus on the health solutions, because having a healthcare solutions for hospitals and even public or even private, I see that the data that we have is purely a lot of data that making our users become more work to do in terms of entering all the necessary information. So this is where we come in. We advise them on how to simplify their processes to reduce the tasks that you need to record, whereby some of the data is not required for your statistics and your reports. So we have achieved this by implementing our solutions, some of the public healthcare like UMMC, USIN, UITM, or even SQH. So these are the ways that we do for our healthcare providers.
Right. So maybe you could tell us a little bit more about the challenges that you face in this, when you have to do change management, right? Yeah. Or what are some of the interesting or most challenging things that you've had to face?
The challenging part will be being a doctor and being a technology healthcare provider. Both parties have to understand their role in terms of implementing healthcare solutions. So if you can't collaborate in terms of understanding each other's, complementing each other, it's going to be very difficult to implement the healthcare solutions, even in public hospitals or even in private hospitals. So these are the areas that, the challenges that I face. And the other part is transformation. The digital transformation in public health is very difficult when it comes to the resources. The resources that we have in public hospitals, most of them has been there like more than 30 or even 40 years, more than 30 years, for example, right? So they are so used with the current solutions, the current UI, the current interface, and changing a new features will be troublesome for these elderly people to learn new things. So these are the areas that the difficulties that we face in public hospitals. Whereas in private hospitals, most of them are very well versed in IT. So it's easy to implement and understand how IT works for the hospitals. So these are the most of the challenges that we face for implementing in public and even private hospitals.
Sorry, most used phrase in 2021 is still you're new. Yeah, you're new, right? So Yeah, I mean, it's actually a big challenge, and I understand a lot of doctors are very smart people, and but unfortunately, if they don't, they're not specialists in technology fields, it's going to be very difficult to communicate with them. And I suppose the next question I would like to direct to Dr. Jin. Now, Dr. Jin, you yourself have actually implemented a telemedicine in a institutionalized hospital. Before joining DoctorOnCall, I believe, right? So, can you share with us how that landscape has actually changed, and what was it like then, and how is it like now?
Thanks, Dr. Prathaban. So, firstly, let's define first when you refer to then and now. When is then and when is now?
So, your first hospital implementation, that was about what, 2 years ago, was it?
Yep, that's true.
Yes, and today, I mean, pre-pandemic and post-pandemic, basically.
Well, I've left the hospital industry for about 1 year ago, and I think 2 years is pretty much of a short time. So I don't think I can give a good gauge of how have things changed in the past 2 years and between now. But I have been in the healthcare industry for probably about 7-8 years already. So what I can share is from when I first started in healthcare and now how things have changed. I think variety. I think what has changed is variety, right? So when we first started, there's probably only about a few providers in this space. But over the past 8 to 10 years, we're beginning to see a lot more come into the market. So I believe that's a good thing. It means probably this is due to an overflow of expertise coming from other industries. So the tech guys from other industries are probably now delving into healthcare as well. So I think that is a good sign. Another way to look at it is probably also because they see profitability industry, right? If not, why would more companies come into this area? So I think these are all stepping stones for growth, right? So to add to that, to address the question, right, on when you mentioned, will hospital become more or less relevant in the digital age? So I think there's 4 perspectives I could give. And in some sense, it's a bit of a loaded question, right? Will hospitals be more relevant? Most common sense will tell you, of course, hospitals remain relevant. But if we were to postulate it, the truth is we can look at it in a few angles, right? So angle number one, hospitals become less relevant in the digital age. The truth is there's a positive and negative angle to it. The positive aspect is we can see more decentralization. So in the past, any healthcare need, you can only get it in the hospital. But like what our friend Dr. Raymond mentioned, even in Singapore, they are moving towards ambulatory care. So with the advancement of technology, we're beginning to see specialists and acute care managed outside of the hospital. That's a positive aspect. And even in DoctorOnCall, there's this project with the DocPod, and things like that, where we are placing healthcare in very remote areas. But there's also a negative aspect to it, where the positive aspect is decentralization. The negative aspect is exclusion of care. So if every healthcare startups wants to play their own game, and the hospitals say, we do not want to engage and we do not want to participate, you will end up having patients managed up to a certain extent outside the realm of the hospitals. And when they end up in the hospitals have no idea what's going on with them. So we want to avoid that. So in that sense, how then does hospital becomes more relevant in the digital age? So this is where extension of care comes in. Like from the previous session, Mr. Ezuan spoke about the use of digital therapeutics, and even I myself have experienced launching digital therapeutics in a hospital. Now, we allow visibility of the patient beyond the 4 walls of the hospital. I don't want to spend too much time elaborating on it, but maybe we can talk about it in more time. So extension of care. And how then does becoming more relevant affect the ecosystem in a negative way? That's where it becomes monopolization of care, where hospitals with conglomerates, right, and we know who they are, right, which have tons of money to spend to invest, begin to just move beyond hospitals and offering a variety of services that even delves into primary health. There is a potential effect where they price out, other earlier startups and innovation components. So these are various angles right? And my thoughts on the matter. Thanks.
Thanks, Jin. That's amazing. Before I go to the next question, I just want to address Dr. Jason from the audience who's asking, smartphones penetration amongst Malaysian population is over 93% in 2020. Why are healthcare institutions taking such a long time to undergo digital transformations effectively? Jason, I'm not sure who you directed that question to, but I leave it to the panelists. Maybe Ezuan, maybe you'd like to chime in on that?
This is also a puzzle for us. Well, yeah, 93% population, smartphones is everywhere, right? But the thing is, the HealthTech, the health apps trend is not there yet. I mean, maybe we need to do a lot of, I'm not sure, maybe we need to do gamification plans. Actually, for local startup, there's a lot of, I mean, I can say most of the startup here is, especially HealthTech, they have apps available. But then why the take-up is quite low? I think first, maybe because of there's a lack of awareness among us. We need to do a lot of campaign. We need, maybe gamification is one of the way we can collaborate with other high traffic kind of apps, or maybe super apps collaborate. We need to do, maybe we have to join our forces together to promote this our apps into the market. So instead of we just go in silo, only Medkad, maybe we can work with Helmetry, or maybe Dr. Raymond and maybe DoctorOnCall itself. We can work together, we join force, we do our own campaign like what we have today. Do something interesting just to promote. This is one way from the way I see it. We need more campaigns on this.
Yep.
Can I add something, Prathaban?
Sure, please.
On what Ezuan mentioned. I think it's a very good question from Jason. Why, right? So we look at the penetration of smartphones and our internet. Of course, we are not into 5G as yet, right? One must understand, right? Healthcare is really different from other sectors, because healthcare is one of the most complex and heavily regulated industry. And sadly to say, we are the least disrupted industry, right? Hence, there's still a long space for us to actually innovate and continue. And because of the complexity involving so many stakeholders, from policymakers, we talk about 4 Ps, right? Outside 4 Ps, there's still others, with policymaker, payer, patients, and providers, right? And it's a complex industry. And like what Ezuan mentioned, right? We are still in the very early stage of awareness and education stage, right? And I give you a very good example, right? And how come all these institutions taken long time to innovate, to digitalize their practices? Not. If you look at prior COVID-19, right? Hospitals might take years to integrate into the HIS, hospital information system, right? For instance, having a telemedicine, I'm sure Jin would know better than me, right? And you look at COVID-19, right? Things actually roll out within 4 weeks, right? They actually came up the whole telemedicine or telehealth solution because of 4 weeks. And that actually boils down to the pain, right?
Yep.
Pain is the trigger, right? Because we are all comfortable, it will take ages, to integrate costs, incur and whatnot, complexity, right? But when the pain hits, when you have 70% reduction of the hospital, visits from the Indonesians, for instance, you will do things whatever it takes, right? So hence, we saw a lot of private hospitals adopting, be it Zoom, Skype, or whatsoever, or even created their own, like what Jin did previously in his institution. I think that's a very good example of actually our capacity and capability of going digitalization. Is really, we need the pain to trigger us, right? And to move, to innovate. Otherwise, we're always in the comfort. We really need to take a leap of faith to come out of comfort zone and disrupt and innovate. Not for the sake of disruption, but really to improve the status quo. Yeah.
Dr. Prathaban, let me offer a different angle, right? So, probably the fact that 93% of the population is already digitally connected itself is the problem, correct? And try to look at it this way, right? So, perhaps the lag in healthcare is relative, it's perceived, because everyone is connected to mobile phone. Everyone is so used to the experience in mobile already. So, the the same usability to translate across into healthcare. But the truth is, the healthcare itself is very wide. So it's not really fair to say that healthcare hasn't gone through digitalization, right? When I mean yourself, myself, Dr. Raymond and Dr. Jason have been practicing when we first started. The ventilators are already partially digitized. Your ICUs are already digitalized to some extent already. So I think it will happen over time. It's just that probably the usability aspect hasn't really caught up to the rest of the other industries like banking and food delivery, the likes of Grabs and the rest of them. But I think we are getting there. We are investing into UI, we are investing into UX, and the whole consumer experience thing. Yep.
I would like to add on, Dr. Prathaban. Based on the experience that I have implementing in hospital, especially public hospitals here. So the lack of the infrastructure, the technology infrastructure in the hospital is one of the reasons I would say to have this mobile penetration among the healthcare practitioners in the hospital itself. Because due to the what it calls legacy system, you can't upgrade infrastructures, due to certain application and with networks that's quite old, 10 to 15 years ago. And to change the whole infrastructure will take more cost to replace the whole systems, right? So, because the new technology that we have right now, more to the cloud solutions, and it's more like it's easy for us to have the information just by clicking certain blockchain, and then we can just transfer the information. I have to agree with Dr. Raymond in terms of regulations. This is one of the areas that also MOH, when it comes to healthcare, there's so many regulations that in place, and it's quite difficult for even a patient to switch on their mobile in the bed to surf internet, you see. So because of the patient data safety, is very important that people can just penetrate the infrastructure. Yeah, so these are one of the areas I just want to add on the technology part for hospital.
Thanks, guys. That's all very fantastic insights. I'm just going to go. Edmund is not from the healthcare industry, I suppose.
No, I'm not.
And has chosen to come in. I really admire people who didn't not from the medical industry and then decide, hey, let's go into the most challenging, complex and make a difference, right? So smartphones, systems, old technology, new systems, putting them all together. How is HealthMetrics providing technology or innovation, right, to kind of like change the future of healthcare, right? What are we to expect? What kind of innovations that you guys are maybe pushing out, that is going to help change this this environment that we're in?
Yeah. Okay. So when people talk about digital transformation, people kind of imagine like a rocket flying to the moon and those kind of stuff. So being a technology practitioner myself, and a very practical one at that, I always aim to, and also HealthMetrics itself, I always aim to actually solve a problem that holistically. So we are not trying to over-engineer like those kind of transformation in this case, right? So whenever we figure out the next problem to solve, so basically, so I am not from healthcare sector, but my partner Alvin is from healthcare sector, and he has like this family business that he has been. So he kind of realized what was the inefficiency, also the problem with the healthcare sector. So most of the time, that's where he actually said that, okay, you know what, we have like this sort of issue with the industry and what we can do about it, right? Our approach is actually pretty simple. So I think it's rather practical. So what we are trying to do on our side is actually to just take one thing at a time and try to actually like digitize it, right? And sort of like improve the experience overall. So I guess that's really, there's no mad science and those kind of stuff over there. But I think in terms of HealthMetrics, our goal is really like to cover the end to end, especially and we are trying to angle it from the organization point of view, right? I think there is multiple ways you can tackle like this kind of issues. and you can go directly to the patient itself, right? And in our case, we actually chose to go with the payer side because we think that our impact will be the largest over there. Being able to, okay, if you get organization on board, then you're actually bringing this sort of improvements to like thousands of members in time, right? That is where, and then it sort of like propagate from there. So when you get things right this, and then it's easier for you to actually to effect changes down the road as well. So we are doing it one thing at a time. We do something, we try to think of it in terms of holistically and how we can actually like synergize with other players in the industry as well. So the part where that is our core, we're going to do it ourselves. But the part that is not our core, for example, like I think in order to make this experience better for everyone, we will probably we all of us need to work together, and this will like even like having like a clinical management system or hospital management systems to work with us. And truthfully, those are not our strong point. Those are the parts where we can actually work better together, and that's we really need to come together and sort of integrate and deliver a better experience for everyone.
Any examples of these technologies which you've implemented to help, accelerate this digitalization in hospitals?
Yeah. Okay.
Sorry.
Yeah. So in some hospitals, right? I will draw one example, which is what happened recently, right, during the pandemic itself, which is like the COVID case itself, right? So more often than not, like like you have hospitals or like chains of clinics that have their own marketing team in order to actually ensure their survival, right? In this case, right, because of the degradation of the foot traffic, like lower businesses and stuff like that. So on our side, what we have noticed is that we have a lot of clinics out with us, right? They are also experiencing similar reduction in terms of footfall as well, right? And and what we actually did back then is to actually identify to our to our members, right? If some clinics are actually providing like COVID tests, for example, right? These are the smaller clinics that they don't have a clinic chain and they don't have a marketing arm to actually do things like this, right? So we actually provide like this sort of like discovery, for our members. Okay, thinking of getting a COVID test, and these are the places that you can go, right? And we built this thing like during the pandemic itself, like how you can actually like discover services like this. Yeah.
All right, great, thanks. There's a question that's been upvoted. It's from Dr. Jason again. I often hear that hospitals will eventually transfer the cost of IT implementation or digital transformation to the patients. Is that true? I thought digital transformation is meant to provide care and more efficiency, right? So do you guys foresee that the cost of digitalization will eventually be borne by patients? That's your Hanizar.
Okay, I can maybe take the first one.
I think Dr. Jin answer this because he's coming from the Sunway part, right? Yeah, Dr. Jin from Sunway, so he knows on how private hospital works. So
okay,
I leave it to him.
What do you think?
So Dr. Jason is probably being a little bit cheeky here.
Yeah, exactly.
Right. So digital transformation is an ongoing process, right? Like any other investment. So I don't think I can adequately answer the question whether the cost of digital transformation will directly go to patient or not, because the truth is no different from any capital expenditure, initiative, right? So getting a better computerized system, it's not very different from investing in better beds for all of the patients, or paying the nurses more to get more experienced nurses in the hospital, right? It's a whole package, right? So yeah, there's no, I don't think we can directly a correlation there. But I think what he mentioned, the second part of his question is a bit more interesting, right? Does digital transformation really improve efficiency? And that's where the crux is. And it's very difficult to sort of prove it. So, of course, the vendor, right, the person selling the transformation will come up with all sorts of ways to justify it. And in the end, whether it's true or not, it really depends on case-to-case scenarios. But I think overall, yes, from my experience, quite a lot of digital transformation really do improve efficiency. I can give a few examples. So I think back where I practice, they implemented a system, right, to track points throughout the entire patient journey. And, with this system, essentially you be able to find out whether there are bottlenecks happening, whether is it at the pharmacy or the registration counter, and therefore the hospital has thus reduced waiting time to probably about half an hour and things like that. So yeah, we do see improved efficiency about the whole system to check in, before you step in. So even before Salanka or MySejahtera launch, we have already implemented something similar in the hospitals, whereby patients have to go and write down all their details. They can pre-register beforehand and scan the QR code. So yeah, we do see improvements in efficiency.
Thanks. And what about, technology is implemented, or, new solutions are implemented to actually improve efficiency and eventually reduce cost, right? So would you see the inverse happening? Would hospitals then be, or would providers then, or even payers be able to reduce the cost to the patient with these technologies?
Okay, let me give you a very simple example, right? So the talk is always hot in the topic of electronic medical records, right? And, what changes it can do, improvement of patient safety, efficiency, and things like that. The truth is, you don't even have to go too far. Hospitals, to some extent, are desperate to implement electronic medical records because they have run out of space, physical real estate to store the patient's files. And I think I rest my case having said that. The rest is all just the icing on the cake already.
And maybe Ezuan, how are we going to be able to reduce costs? What are the kind of innovative ways, and what are the opportunities for kind of like if a startup today, right, wanted to jump into the healthcare space, and join this digitalization bandwagon, right? So what are those kind of examples you think that would be valuable?
Well, there's a lot of angle. I mean, if for new startup want to join into the wagon, right? So first and foremost, they have to join this 2-day session lah. Okay, so we have to bond together, enforce together, join forces lah. But the thing is, for new startup, I think like Dr. Jin mentioned, EMR is a hot thing. And then years before that, it's all about blockchain. I think this is the angle that we can look into moving forward, combining EMR, blockchain, and then into payer and also supplying segment. When it comes to the price saving supplying segment, right? So this is where the analytics, the data, the price from the supplier, we can see there's a lot of high margin that we can do, which in return we give a fairer, again it's about fairer price, fairer service back to the patient, because you can see there's a lot of potential that we can actually help society back from the analytics study. So this is my point.
Can I add something on this?
Sure, Doctor.
Yeah, just to add on what Dr. Jin and Ezuan mentioned, right? So I think Jason's question, I mean, it's quite tricky, right, from here. Yeah. So we talked about cost saving, right? And to be frank, right, it's really cool to measure at this point of time. While when we are in the very early stage to measure, like the cost saving part, optimization, and even efficiency part, right? So it's really crucial. There's so many type of solutions out there, right? And I think what is more important is actually what we call the values, or the value-based care, right, where we actually look at, like what Asram previously talked about outcome. So really about quality of care, and the outcome of care with the lower cost, right? The lower the cost of the values. And how do we actually reduce the cost is actually through all this efficiency, the innovation. When I say innovation, not necessarily is about technology. It can be part of your processes in the hospitals, in the insurance claiming, right? In the workflows, right? If by any means from technology or non-technology, you can actually help to make it efficient and more cost saving, that will transfer this saving to the patients, to the payer, right? So really it's about, the whole value-based care, as I always define it as, the quality of care multiplied by outcome of care divided by cost. The lower the cost, the better values. The better the outcome, the better the values, right? So hence, we have to actually move towards, like what Asran previously mentioned, to the paradigm shift, right? To really focus on the outcome rather than the process itself, right? So we focus on the outcome of the patients. How often the patient have to come back to the hospital for another second surgery, for instance, right? So if we actually able to focus on outcome, that's where, the truly the whole transformation comes about. It's not really about technology. It's about the whole tech and non-tech, right, and innovation that we'll talk about. Yeah. So saving is just part of it, really. Yeah. Thanks.
That's absolutely right. I think the first thing we learn at medical school, it's all about the patient-centered care, right? And thank you as well, everyone. You're absolutely right. The best way to learn and find out more ideas is to attend this seminar. And on that note, we are entering the last 10 minutes of our session. And I would like to give an opportunity for our speakers today to shout out and tell other companies, right? I already see a few collaborations that are going to happen after this session right now. So, but I want you guys to probably maybe give a bit of a shout out and say, like, if you want to collaborate with us, how could you do that? Maybe we can just go out. We can start with Hanizar.
Well, my side, collaboration is one of the key role on healthcare technologies, because healthcare technologies is more like it's not a fast-making business. It's a long-term business, you see. So when the new startups come into the picture, you should work together hand in hand with the existing startup technology to actually collaborate and move forward with the same visions that you have in healthcare technology to implement for the healthcare centers, right? So collaboration is very important. You have to understand first, not only something that nice to have kind of a solution, you must work together hand in hand, maybe with the doctors, the researchers in the hospital, the society, to see whether these particular solutions can actually benefit the society. So it's nice to have to do something very advanced technology, but then if you don't really cater to solve that problems, it doesn't solve the problems, is it? So by collaborating with these technology partners, existing, it actually helps them to actually understand better what are the solutions is the best to implement.
And how would our audience collaborate or partner or work with HealthTics?
I would say we can actually work together in terms of, let's say they have some selected solutions, for example, for hospitals, right? So don't look at the angle of the bigger picture. Try to find the solutions that complement the current solutions that they have in hospitals. For example, like Dr. Raymond's solutions, Ezuan, and even DoctorOnCall. These are the complementary kind of solutions for the hospital itself. See? So rather than thinking the same solutions that you have in the hospital, try investing and look for some funders who actually can develop the solutions that complement the solutions. So that's one of the areas that you can go through for the startups. That we can assist them. Because for the experience on the understanding the policies, the SOP in the hospitals, these are the things that startups are quite lacking in terms of understanding what are the solutions to be implemented in the hospitals. So yeah, this is what we can give to them.
All right, that's great. And next, can we maybe have Edmund? How would companies reach out and collaborate with HealthMetrics?
Yeah, so HealthMetrics have always have this policy of working with other partners as well. I think we are currently also working with doctors as well in terms of like some of the drug delivery. So we have Health Metrics is very collaboration friendly. So we have this long running policy of like working with others. And if you are actually a startup, and I guess it's understandable, right? I share the same sentiment with Hanizar. What we are trying to do here, we're trying to solve a very hard problem, and it's really, really hard to solve. And I guess unless you are already from the industry itself, it can be very hard for you to understand, especially when you're just starting off. Like now, right? I can speak from experience. It's actually pretty hard for me to understand, like, or appreciate the entire complexity of this entire thing, right? So, but I think today, right, we are actually in a much better stage compared to, you know, like maybe 5 or 10 years ago. We have a very strong community, right? There is MDAC, there is Magic, and all this actually serve as a very good launchpad. And if you are actually like just starting out, I'm pretty sure you can join all this event and then like get to engage with one of us. And I think none of us are stingy when it comes to like sharing the issue with the industry itself, because we cannot solve everything. Like we all want to provide that sort of end-to-end thing, and we can only do it if we all work together. So you can come to talk to us in terms of like problem discovery and you know, like what to work next. What are things that is really lacking in terms of the industry itself. Yeah. So and if you're actually really looking to collaborate, again, Health Metrics is very open for collaboration. Reach us out anytime, you know, on Facebook or LinkedIn. We actually have a dedicated team that actually talks to people in terms of collaboration. Yeah.
Okay, thank you very much, Edmund. Dr. Jin, how would companies collaborate with DoctorOnCall?
Yeah, so I think at DoctorOnCall, we have quite a large audience and viewership. I think we are 3 million going on 4 million visitors per month to our website, and also to interact with our content. And also alongside that, we also have quite a large network of care providers which we are partnered with. So I think if you know anyone in the audience is a healthcare provider or a digital health solution, whether it's AI based or is it a digital therapeutics, what we can do is really to find a good fit and maybe even innovate the service or the product a little bit so that it fits nicely into the market needs and the market demands in the local and also maybe hopefully regional healthcare setting. So I think, that's where we can look to collaborate with, by really working together to deliver new products and services into the market, into our existing audience.
That's great. Ezuan, Medkad,
Okay, sure.
how would people reach Medkad, and what collaborations would we be looking forward to?
Well, actually, we are quite open to any startup. Just approach us to our Facebook or LinkedIn Medkad account, or you can always reach to my personal directly. It's Ezuan Yaakob. You can always find my Facebook and LinkedIn. Secondly, Medkad has more than 3,000 panels nationwide, and if you have any ideas or any startup want to test that or experiment opportunity through us, just reach us. So we will try our best to help you guys.
All right, that's great. Thank you. And of course, last but not least, Dr. Raymond, how do we collaborate with Dr.
Yeah, I think all the panel speakers has spoken my mind, right? So basically, startups, right? We live on data and cash, right? Especially the tech side, right? And not only that, actually, one of the very important nutrients is actually collaboration, like what all the others have been talking about. So we usually don't do things that we are not good at, right? So that's why we welcome all form of collaborations, be your providers, you are the tech, you are the AI, right? To really work together to actually maximize the whole values that we have, right? So we might be actually providing this, right? Who knows, with the collaboration, we actually make the pie bigger or even make the new pie. So hence, for all the new startups, one thing I learned about being a startup, right, is actually be resourceful, right? We have to be very resourceful on know who to actually go on and know who to actually get help from, right? So once you're very resourceful, right, and or you're in the ideation phase, right? So you need to test out your ideas and go to prototype, MVP, and whatnot, right? Really, right, it's about the sports brands say, right, the tagline, just do it, right? So we have to be very thick-skinned and just go for it, and then go for all these speakers. They are wonderful platforms, right? Go to them and test out your ideas. See how it actually can work out, and there will be chemistry and synergies. You'll be surprised. So do not be afraid to reach out and to collaborate. In fact, we actually always reach out to different partners, like like Ezuan. We reach out to them, right? Let's work together. We think this is something going to be very beneficial to the patients and the group. So just do it and be resourced and be thick skin. All right, that's all from me.
Okay, everyone. Now, before we end, I would just like to say a very special thank you to our audience, for sitting through with us for the last 1 hour. Okay, I hope that you had some good insights on digital transformation in hospitals and payers, insurers. Of course, we covered a lot of topics. Okay, and I would like then now to thank all of our panelists, Hanizar, Edmund, Jin, Ezuan, Raymond. Okay, continue to call all of their contact details are on their profiles. Okay, do reach out, do make the industry, do make the ecosystem that we have today ready for what's going to happen in the next coming years. We're literally at just outside ground zero right now of this transformation process. It's taken a long time, and we have an opportunity today to accelerate it even further because of the pandemic. Right, so please keep the networking going. Please enjoy your sessions here today, and thank you very much, everyone, joining us this afternoon.
Thank you very much.
Thank you, Doctor.
Thank you.
Thank you, everyone.